Hello everyone. So previously I had spoken about renal pelvis dilatation, which is basically a swelling of the part of the kidney of the fetus, which can happen due to multiple reasons. And somebody had asked query regarding this. Now, renal pelvis dilatation, basically I'm talking about it again, that it is supposed to be dilated when the renal pelvis measures about a certain measurement in particular periods of the pregnancy. So when we do an anatomy scan at 20 weeks, we measure the renal pelvis, and if it is more than 4 millimeter, we say it is slightly above the normal. Now this can happen due to many reasons. It can be just physiological, which means that if some urine tends to stay back, or there is some difficulty of the urine being passed out of the kidney, that stays back and that causes this dilatation, as we call it. Or it can be associated with other chromosomal problems like Down syndrome and everything else. But usually, if there is an association with Down syndrome, there might be other things in the fetus which might show. And sometimes your first trimester combined risk, which we do between 11 to 14 weeks, that might also come positive. So if the renal pelvis dilatation is isolated, which means that there is nothing else apart from this, then the risk of this being associated with chromosomal abnormalities is very, very low. And it usually only indicates a mechanical obstruction or just a physiological transient finding which will resolve with time. So usually if this is the only finding at anatomy scan, you don't need to be worried. We call you back again at around 28 weeks and we measure the renal pelvis again. And at that point in time, if the renal pelvis is above 8 millimeter, because as the fetus grows, the pelvis also the size grows, and then the criteria for calling it abnormal changes. So what is 4 upper limit of normal at 20 weeks becomes 8 at around 28 weeks. So if it is below 8, then nothing to worry. But even if it is above 8, there is nothing to worry. We just follow it up, and as long as the fluid around the baby is normal, which means that the kidneys are functioning normally for the baby to pass urine and maintain the fluid in the pregnancy, then there is really nothing to worry. Maximum, in these babies tend to have an increased pelvis dilatation till they deliver. Then they need ultrasound of the baby's kidneys after delivery, and the neonatologists and pediatric surgeons will follow it up. But more than 90% of the times, these fetuses have a normal outcome and nothing more than a regular follow-up and possibly some antibiotics. Thank you.